What if I told you that a single breath, just one, could tell a doctor a whole complex story about what's happening inside your body? It almost sounds like something out of a sci-fi movie, right? But that one simple movement is absolutely packed with hidden clues. And today, we're going to uncover them. So let's play detective for a few minutes. We have one major piece of evidence and four potential culprits. Four different medical conditions that could be hiding inside the lungs. Our job? To figure out which is which, just by looking at how someone breathes. And this is our primary clue. Chest expansion. It's really just what it sounds like, how your chest moves when you take a breath in. Now, I know what you're thinking, it seems way too simple to be useful, but as we're about to see, whether it moves too much or not enough can be one of the most powerful signals your body ever sends. Okay, so to kick off our investigation, we need to understand how breathing itself works as a signal. We're going to split this into two very different paths, following two completely different kinds of clues. First, we'll look at the really weird situations where the chest seems to expand too much. Then we'll flip it and explore the opposite, when it just can't expand enough. All right, let's start with our first category, when the lungs seem to overexpand. These are what I like to call the counterintuitive clues. I mean, you'd think any problem with the lungs would mean less movement, right? But sometimes a really serious issue actually makes the chest look like it's expanding even more. How on earth is that possible? Well, the evidence is pretty surprising. So our investigation starts with two main suspects, a pneumothorax and a large pleural effusion. Now, both of these can make one side of the chest look bigger than the other. But did you catch that little word, apparently, next to the second one? That's a huge hint that these two clues are definitely not what they seem on the surface. Our first case file is pneumothorax. The easiest way to think about this one is as the case of the trapped air. It's basically where a leak creates a kind of one-way valve around the lung. The key here, the absolute key, is that trapped air. It's like trying to let the air out of a balloon, but the knot is sealed shut. The lung just can't fully deflate when you exhale. So on the very next breath, it's starting from a more inflated position, which makes the overall expansion on that side look way bigger than normal. Okay, next up we have a real master of disguise, a large pleural effusion. Let's call this one the case of the fluid bulge, and believe me, it's tricky for a completely different reason. Now this is so fascinating because the chest looks bigger, but it has nothing to do with expansion from breathing. Instead, a whole bunch of fluid has collected around the lung, and its sheer weight and volume are physically pushing the chest wall outward. It creates a bulge. So even though the chest wall is actually moving less when the person breathes, it just looks bigger when they're at rest. A very, very sneaky clue. So we've seen how too much expansion, or what looks like it, can be a major red flag. But what about the opposite? Let's pivot our investigation and look into our second category of clues, when the lungs just can't expand. These are the restrictive clues, where something is physically holding the lungs back. This brings us to our next two conditions, consolidation and fibrosis. Now, at first glance, they seem identical. Both of them lead to decreased chest expansion, but the reasons why are completely different, and that's where the real detective work comes in. First up is consolidation, which I call the case of the solid lung. This is something you might see during an illness like pneumonia, where parts of the lung literally change their entire texture. The logic here is pretty straightforward. What's happening is that the normally spongy, air-filled lung tissue gets filled up with fluid and other gunk, making it dense and solid. Just think of a dry sponge versus one that's totally waterlogged. You just can't squeeze any more air into it, right? Well, that solid part of the lung just can't expand when you try to breathe in. Simple as that. And that brings us to our final piece of the puzzle, fibrosis. This is the case of the stiff lungs, where the problem isn't fluid, but the lung tissue itself. In this case, the lung tissue becomes stiff and scarred, and it loses what doctors call its compliance. So instead of being like a flexible balloon, imagine trying to inflate a thick, old car tire with your own breath. It's just not going to stretch. And the crucial clue here is that this condition usually affects both lungs, giving doctors a really clear symmetrical signal. Wow, okay, so we've now looked at four very distinct clues and four very different conditions. It's time to put it all together. Let's step back and see how solving this puzzle actually works. Bring all our evidence to the table for the big reveal. And there it is, the solution to our whole puzzle. Just look at how powerful one single observation can be. Is the expansion increased? You're probably looking at trapped air. Does it just look increased? You should suspect a mass of fluid. Is it decreased on just one side? That tissue might be solid. And if it's decreased on both sides, well, the lungs themselves are likely stiff. It's amazing how a doctor can go from such a simple clue to a complex diagnosis. So, what's the big takeaway from all this? First, chest expansion is a simple but incredibly powerful first clue. Second, just remember that increased expansion could mean trapped air or a deceptive fluid bulge, while decreased expansion points towards solid or stiff tissue. And maybe most importantly, this is a perfect example of how one small clue is just the first step in solving a much, much larger diagnostic puzzle. It really makes you think, doesn't it? If a single, simple breath can reveal this much, what other silent signals is your body sending you right now? The clues are always there, waiting to be understood.